There is a cancer growing inside thousands of Americans right now, and it gives almost no warning. By the time most people are diagnosed, the 5-year survival rate is just 14%. That means 86 out of 100 people will not survive 5 years after diagnosis. It is now the 4th leading cause of cancer death in the United States, and one of the reasons is brutally simple: it hides deep behind your stomach, with no nerve endings to warn you, until it has already spread. Today I am going to show you exactly what pancreatic cancer is, why it is so deadly, the 7 warning signs that appear before it is too late, and the one combination of symptoms that should send you straight to a doctor today. Sign number 5 is the one that doctors themselves often miss for months, treating it as a completely unrelated problem. Your pancreas sits deep in your abdomen, behind your stomach, tucked against your spine. It produces digestive enzymes and the hormone insulin that controls your blood sugar. Because it sits so deep and so far from your skin's surface, tumors can grow for months, sometimes years, without causing any noticeable symptoms. There are no nerve endings near the pancreas to create early pain signals. By the time a tumor is large enough to cause symptoms, it has often already invaded nearby structures or spread to other organs. This is precisely why pancreatic cancer is called a silent disease, and why catching the early signs matters more here than with almost any other cancer. Here are the 7 warning signs you must never ignore. Warning sign number 1: yellowing of your skin and eyes, jaundice. When a tumor forms in the head of the pancreas, the most common location, it can block the bile duct that runs directly through that area. Bile backs up into the bloodstream, causing a yellow tint to the skin and the whites of the eyes. This is often the first visible sign that brings patients to a doctor, and while jaundice has other causes, when combined with other symptoms on this list, it is a critical red flag that demands immediate investigation. Warning sign number 2: dark urine and pale, greasy stools. This occurs alongside jaundice for the same reason. As bile backs up due to the blockage, it is excreted through urine instead of through normal digestion, turning urine dark amber or brown. At the same time, stools lose their normal brown color from bile, becoming pale, clay-colored, and often greasy or floating due to poor fat digestion. This combination, dark urine with pale stools, is one of the most specific warning combinations for pancreatic and bile duct problems. Warning sign number 3: unexplained, significant weight loss. Losing 10, 15, even 20 pounds without trying, without changing diet or exercise. This happens for 2 reasons. First, a pancreatic tumor often impairs the production of digestive enzymes, meaning your body cannot properly absorb fat and nutrients from food, no matter how much you eat. Second, cancer cells consume enormous amounts of energy, accelerating metabolism, and burning through fat and muscle reserves rapidly. Unexplained weight loss of more than 5% of body weight in 6 months always warrants medical investigation, and is one of the most consistent early signs reported by pancreatic cancer patients. Warning sign number 4: new onset diabetes after the age of 50 with no family history. This is one of the most overlooked warning signs in modern medicine. When a tumor disrupts the insulin-producing cells of the pancreas, it can trigger sudden diabetes in someone who has never had blood sugar problems before and has no family history of diabetes. Research shows that new diabetes diagnosed after age 50 can sometimes be one of the earliest detectable signs of pancreatic cancer, appearing up to 2 to 3 years before the cancer is otherwise diagnosed. If you suddenly develop diabetes later in life with no clear explanation, this connection needs to be raised with your doctor directly. Warning sign number 5, and this is the one doctors often miss for months: upper abdominal pain that radiates to your back. A dull, persistent ache in the upper abdomen that seems to bore straight through to the back, often worse after eating and sometimes relieved by leaning forward. Because this pain pattern overlaps so closely with common conditions like back strain, gallstones, or ulcers, patients are frequently treated for months with physical therapy, antacids, or pain medication, while the underlying tumor continues growing undetected. If you have persistent upper abdominal and back pain that does not respond to standard treatment, push for imaging. Warning sign number 6: loss of appetite and feeling full after eating very little. Patients describe feeling satisfied after just a few bites, or losing all interest in food they used to enjoy. This happens because the tumor can press against the stomach or surrounding structures, and because cancer itself releases chemical signals that suppress appetite throughout the body. Combined with weight loss, a sudden disinterest in food in someone over 50 is a pattern that deserves medical attention. Warning sign number 7: sudden blood clots with no clear cause. Pancreatic cancer is associated with a significantly elevated risk of unexplained blood clots, particularly deep vein thrombosis in the legs, causing sudden swelling, pain, and warmth in one leg. This happens because pancreatic tumors release substances that increase the blood's tendency to clot. While blood clots have many causes, an unexplained clot in someone with no obvious risk factors should prompt a broader medical investigation that includes screening for underlying cancers. Now, the combination that matters most. If you experience unexplained weight loss together with new upper abdominal or back pain, or new diabetes after 50 combined with weight loss, these specific combinations are the patterns that oncologists are trained to recognize as red flags for pancreatic cancer. Individually, each symptom can have many innocent explanations. Together, they form a pattern that demands an answer. If pancreatic cancer is suspected, doctors typically order a CT scan or MRI of the abdomen, blood tests including a marker called CA19-9, and in some cases an endoscopic ultrasound, a procedure that allows direct imaging of the pancreas from inside the digestive tract. Early detection dramatically changes outcomes. When caught at the earliest, localized stage, before spread, 5-year survival rates rise significantly higher than the 14% average for all stages combined. The earlier this cancer is found, the more options exist for surgery and treatment. If this video helped you understand something you or someone you love has been experiencing, please share it right now. Pancreatic cancer is hardest to catch precisely because its early signs look like dozens of other harmless conditions. Awareness is often the only early warning system that exists. Subscribe and hit the bell, because in my next video I am going to reveal the disease that is silently shrinking your brain right now, years before memory loss ever becomes noticeable, and the early signs that appear during completely normal conversations.